Parent Information Center of New Hampshire and New Hampshire Family Voices with the Yeah Council present the Yeah Council podcast. The Yeah Council stands for Youth, for Education, Advocacy, and Healthcare. We're so excited you're joining us today. Welcome to our series on hiring support staff. In this series, we discuss how support staff can make a difference in a youth's life, the interviewing and hiring process. We have an episode called What Now, which discusses backup plans, and tips and tricks to keep the ball rolling. Welcome back to episode 2, where we're talking about the interviewing and hiring process. This episode had a lot of information in it, so we broke it into 2 parts. In part 1, Keegan discussed the personal care attendant program, and you can listen to that in our previous podcast. In this part 2, Abby is discussing the DSP or direct support professional interviewing and hiring process that she had with her family. Let's get started. Hello, everyone, and welcome back to our Yeah Council podcast series on hiring staff. My name is Ansley Peacock, and I am the Transition Initiatives Coordinator for New Hampshire Family Voices and the Parent Information Center. Part of my job means I get to work with our fantastic Yeah Council and have cool projects like this podcast series. Today, we're talking about the interviewing process and things to consider when hiring a support person. Abby is part of a self-directed services program through her area agency. Abby, can you tell us a little bit about self-directed services, or SDS?
Yeah. Self-directed services means still working with your team, but you have more independence and control. But that also means that my family and myself have more responsibility.
So when you first transitioned to SDS, what happened? How did you get it started?
First, we developed an ISA, which is an individualized service agreement, which talks about the skills I have, the skills I need to work on, and sets the goals to get there. And it outlines the supports I need to reach those goals and the barriers I currently have with those activities, if any. Then my family and I developed a budget for services, and we get to choose who we want to hire, but we are also responsible to figure out backup plans if something falls through any cracks. We are also in charge of a lot of paperwork, such as progress notes, and my mom kept attendance sheets, which outlines which category of life skills we needed to work on that day, or we worked on that day.
Wow, that's a really good overview of that program. And it's an interesting almost trade-off of you get more control and have more choice, but it also means a lot more responsibility on you and your family. Thank you for sharing that information with us. So I need to back up a little bit. When you decided to hire a direct support professional, how did you even begin the process?
A person on my support team, aka my mom, reached out to my service coordinator at my area agency to let them know that I'd like to hire a DSP. I did not need a doctor to recommend me or a prescription, as it was through my area agency in my community.
I think that that's such a good thing for a lot of people to know, because they might be considering that like a barrier of, oh, I'd love to do this, but I don't know if I can start the process without my doctor. So thank you for letting us know that part. In working with Abby and Keegan, I've learned a lot about how an area agency process can differ from what's called the personal care attendant program that Keegan uses through Granite State Independent Living. And Abby taught me that for the area agency, they are the employer. Keegan taught me that for the Granite State Independent Living program, he is a co-employer with GSIL. So for area agency with Abby and her family, the DSP was first hired by the area agency and then interviews with the family. All trainings are through the area agency, and the area agency sets the rate of pay, and the family cannot do more. So thank you, Abby, for allowing me to recap that.
Yeah.
When you were interviewing, what were you looking for?
I was looking for someone close to my age, who I could relate to and have a social connection with and social relationship with, because I had been remote for 18 months and had just come out of high school. I was looking for someone with shared interests like Disney and country music and Hannah Montana, but I was also considering someone with a driver's license because I cannot drive. Someone who's vaccinated against COVID and other illnesses, which is a very hard no for my family.
That's so important, like to have an idea of what you're looking for before you get started and to know what your lines are. I think it's also important to understand or acknowledge that sometimes deadlines don't always give a lot of choice or care needs are really like acute or need to be taken care of. So you don't have a lot of choice in your candidates.
Yes, you are right. You have to go with the candidates who show up. But hopefully, as a client, you can have a say in who your staff will be.
Absolutely. So you let your service coordinator know that you want to hire a DSP, and the area agency started to send out candidates for your family and you to interview. What was the interviewing process like? Did the first person show up and clouds parted and unicorns started singing with rainbows?
No.
Hmm.
Both candidates were, before Shannon, were unwilling to get vaccinated for the COVID-19 virus. And the first candidate thought being a DSP was babysitting, which it's not. And by babysitting, I mean just being here with me and while we painted our nails and stayed in my house and didn't do anything in the community. I needed someone who was able to be my frontal lobe and help me do things around the house and learn how to function on my own, as well as errands and transportation to different appointments. The second candidate was not understanding that a 4 mile hike is not something I can just do on a whim without building up my energy and spoons. A 4 mile walk would be a lot for me at first, but I could build up to it. She was more active than me. Shannon was a great fit because she was attending the same college as I am. Our personalities seemed to click. She had more driving experience than someone our age on average since she lived out of state. She was vaccinated and respected my medical needs due to safety. And she wanted to know more about my medical needs and what I liked. She had a genuine interest.
That is so important. And I just want to acknowledge the work that you and your family put in, as well as the area agency and the service coordinator, to find that good fit. It's almost like Goldilocks or, any other relationship where you have to have someone that matches your interests and, your lifestyle needs as well as your goals. So once you decided on Shannon, what happened next?
We let human resources know at the area agency that we wanted to hire Shannon. She had to wrap up some trainings and then she started later that week.
Oh, cool. So, because she was already employed by the area agency, she just had to finish up some training and then she was good to go with you.
Yeah.
That's awesome. We talk about the wonderful connection that you and Shannon had in our other episodes. So, audience member, go listen to those. Shannon graduated from college last spring and went back to her home out of state, which means you, Abby, are in the interviewing process again. How is it different this time hiring staff for a direct support professional?
It is harder this time since I had an awesome DSP and I know more of what I'm looking for, short of Shannon's clone. I'd like to find someone who is able to see the real me, the whole me, and not just my medical diagnoses, and can support me with staying on track but in a fun way. And plus, I have the tools that we use together and the ones she created for me to use independently, so I have a structure and I am not going blind this time about what me and a new DSP needs to do.
Every time I talk to you, I feel like I get to learn more about the connection that you and Shannon had and how wonderful a support and friend she was to you in your life. I know that you miss her, and I also think it's awesome that you have tools or a framework so that you can get your new DSP up to speed when you find them. Speaking of which, I've heard a lot about the workforce shortage. Has this affected you?
Yeah. From May to now, I haven't had a DSP, and we have put announcements on Facebook trying to find someone in the network and via job boards. But I'm doing very well considering. But not as well as I could be because my family is stressed and I prefer working with someone who is not directly my family so I can stay on task, and plus it feels less like nagging. I am still low on spoons, and Shannon helped me clean after class, which may seem like a little thing, but they add up.
Absolutely. And I think it's so important that people understand with disability and chronic health conditions, those little things do add up. And just because we're capable of doing those things doesn't mean it's not taking that energy away from other things like your math homework or going to classes. So if someone wants to be part of this unique connection and work with awesome individuals like you, do you think that they can reach out to their area agency to get more information?
Definitely.
Absolutely. Do you have any advice to others who might be in the middle of this process or about to start it?
Go with your gut if you can, and acknowledge that it is hard to find someone and have a choice because of the workforce shortage. And use your network to find staff. And give folks a chance, even if they're not meet all of your standards.
Right. Like it's so important as long as those hard no's, those boundaries that you were very smart to have in place, so long as those boundaries are maintained, that you give folks a chance. Like I know that you want someone your age, but I'm sure if someone older came in who was a Disney fanatic and adored, country music like you do and saw you and heard you and respected your medical needs, that you would absolutely give them a chance.
Right.
Yeah. So Abby, thank you so much. I continue to learn so much about the DSP client relationship and the process. I so appreciate you being my guide as we start this podcast series off. And thank you, Abby, so much for joining us today.
You're welcome.
Thank you for joining us today. Get ready for our third episode in this podcast series that we're calling What Now? Let's say you've gotten through the interviewing process, you've hired a support person. What are some things to keep in mind and what are some good backup plans? I learned so much in this episode from our two fantastic YAG Council members. Tune in next time to have some great tips and tricks and things that you're going to want to know in this process. Our music can be found on Pixabay. The recording artist is called Bo Gleason and the track is called Picture the Sky. Special thanks once again to the Parent Information Center and New Hampshire Family Voices for their continued support of the YAG Council, the advocacy and hard work being done by the youth there, and this podcast series. See you next time.